Hello, everyone. Good morning, and welcome to Medicare Changes for 2026. I want to share my screen so that if you're watching this presentation as a recording, you'll get a chance to actually see what I am talking about. So now I believe that I am ready to start. Come on in and pull up a chair, get comfortable as I'm presenting to you. Thank you so much for joining me this morning. These webinars are available to you every Tuesday morning at 11 a.m. Eastern Standard Time. And the purpose of the webinar is to make you fully aware of changes in Medicare benefits, changes in Medicare procedures, changes for Medicare for 2026. Of course, I'm Faye, and I sell Medicare plans. I've been doing this for 23 years, and you can reach out to me. I'll answer any question that you have. I've worked in the insurance side. I've worked in the field. I've managed a team of Medicare captive insurance professionals and now own an agency where I do not represent all plans in your area. If you want to see all of the plans that are available, please contact Medicare.gov, 1-800-Medicare, or call your local SHIP organization to get information for all plans. So let's start with the basics. What is Medicare? Medicare, as most of you know or have heard, is a federal health insurance program. It's for people who are age 65 or older, and there are younger people who may have Medicare because they have certain disabilities and they have received Social Security disability payments for at least 24 months, except for people who have end-stage renal disease or Lou Gehrig's disease. They're able to get Medicare sooner, even though they may not be age 65. So Medicare, original Medicare, is made up of two parts. The first one is Part A, hospital, and the second one is Part B, medical. So those are the two things that Medicare, original Medicare, actually helps with payment for. The Part A, hospital, is inpatient care. So if you're inpatient hospital, it helps with that. If you are diagnosed as using hospice care, it covers that. The inpatient hospital Part A also covers skilled nursing facilities and home health care. Now, when you look at the Medicare language, it says help with those expenses, those covered expenses. And things that are covered by original Medicare are going to be treatments for disease or injuries that are medically necessary. So there's no cosmetics, no fancy things, no terms, the additional things that are added on. It would be medical treatment for things that are medically necessary. And the reason Medicare says help with Part A and Part B expenses is because you're going to have some out-of-pocket costs. You may have deductibles, you may have co-insurance, you may have co-pays, but none of those have a cap. So your out-of-pocket cost is not capped. Part B expenses would be all of those expenses that are outside of a hospital, such as doctor's office visits, lab services, x-rays, outpatient surgeries. Those are Part B expenses, and those are billed differently. And again, Medicare helps with those expenses because you will have coinsurance and deductibles in Part B as well. So the options for Medicare, there's more than one way that you can choose Medicare benefits. You can choose to use Original Medicare, where you don't have to worry about networks. Any provider who accepts Original Medicare, you are able to use their services. But then for those copays and coinsurance and deductibles that come out of your pocket, you will want to get a Medicare supplement, which is also known as a Medigap plan. In that instance, you'll have a monthly premium. The Medicare supplement or Medigap plan comes directly from an insurance company. It's not sold to you by Original Medicare. It supplements Original Medicare. One way that I use to illustrate visually what is a supplement, think of the truck on the highway with the trailer behind it. You know the large trucks, the UPSs, the FedEx, the Prime, those trucks, and then there's a trailer behind it. The trailer can't go anywhere unless the truck takes it. So think of Original Medicare as being the truck and the Medicare supplement is the trailer, because the Medicare supplement will follow the truck. It will only cover those expenses that Medicare, Original Medicare, has approved but doesn't pay. So you buy that policy from an insurance company and you have a monthly premium. Could be anywhere from $130 a month to $200 a month. Added to that, you will need a prescription drug plan. The prescription drug plan is what we call a standalone prescription drug plan because that comes from an individual approved insurance company who offers the prescription drug plan. It has a premium as well. The premium for the prescription drug plan might be $35 to $135, depending on which prescription drug plan you need to cover the prescriptions that you have. So one choice is to use Original Medicare with the Medicare supplement and a prescription drug plan. The other choice is what's called a Part C, also known as Medicare Advantage. The Medicare Advantage plan combines the benefits of Original Medicare Part A and Part B, and in most cases also includes the Part D benefit. Now, the big difference here is now some will have premiums, but the premiums will no way be as much as the premium for a Medicare supplement or a standalone prescription drug plan. But you have all of the pieces that you would have in that first choice that I just told you about in this one plan. And in most cases, you can find a program that can fit your needs with a zero monthly premium. Now, that doesn't mean that you don't have out-of-pocket expenses, unless you have what's called Medicare and Medicaid, which would be a dual choice. You may have out-of-pocket costs when you use certain services if you're looking at a Medicare Advantage plan. Let me make that clear. There are different types of Medicare Advantage plans, and the Medicare Advantage plans that are designed for those people who have Medicare and Medicaid services may not have the out-of-pocket costs that someone who does not have both. So there are core Medicare Advantage plans, which can be an HMO or a PPO, and then there are dual, the Medicare and Medicaid plans that can be an HMO or a PPO as well. But the Medicare Advantage plan does include all of the benefits for Part A, Part B, and Part D. Why should you have an annual Medicare review? There are several reasons, and I'm going to go over those with you. How should changes in your coverage, changes in costs, changes in networks, how could that affect you? Now, you might be the person who will say, I know the plan that I have. I love it. I got my doctor. I'm happy. I'm okay. I don't need to do anything at all. The reason I'm doing these weekly webinars is to make you aware, if you have not even considered it because you're so happy with what you have right now, there are changes for 2026. And I don't want you to be upset. I don't want you to be alarmed. Don't want you to have any surprises. You have received by now your annual notice of change. If you currently have Medicare, no matter what option you've chosen for 2025, by September 30th, you should have received your annual notice of change, or what I term ANOC. That's where the insurance company that you're currently with would tell you if you have a Medicare Advantage plan, no matter what type Medicare Advantage plan it is, you'll get this book that shows 2025 in one column and 2026 in the other column. And those side by side comparisons will be the changes to your plan. And I can assure you that you will not receive an annual notice of change that says 2025, 2026, no changes at all. Every one of your plans will have changes in some way. So it is important that you look at that annual notice of change, or at least sit with someone for 10, 15 minutes and let them go through it with you. There may be options that can help you to save money because of the changes that are coming about. And don't go away and don't get fretful. I will go over what changes you might affect you. All of them may not, some of them will. You're going to have changes. That's the bottom line. You will have changes. So there are some ways that are different for 2026 that an insurance professional can help you to save money. So now, how can I help you? The best way that I can help you is to do that little 10, 15-minute interview right after we finish with the webinar, so that you have the opportunity to know and hone in on whatever changes may affect you. Take 10 or 15 minutes out of your life so that you're not down the road. When January comes, you go to the pharmacy and it's a different story. Trust me, there are changes. So let's talk about what are the changes for 2026. In 2025, prescription drug had some tremendous changes, great changes. The maximum annual amount that a Medicare beneficiary could spend for covered prescriptions was capped at $2,000 for 2025. Well, that amount is going up to $2,100 for 2026. And again, if you have Medicare and Medicaid, your prescriptions were zero, and this was not something that you really had to worry about. However, if you have Medicare and Medicaid, depending on your level of Medicaid status, and each state has their own programs, but each state works on different statuses, levels of Medicaid. Depending on your level of Medicaid, you will have changes in what your prescription drug costs will be. The program that offered you zero for all covered prescriptions, if you had a dual plan, Medicare, Medicaid, in 2025, is no longer available. Let me let that sink in. Let me say it again. The zero for all covered prescriptions in 2025 for some levels of Medicaid is no longer available. Another change that's coming about for 2026 is the flex cards, the food cards, the cards that you could use, particularly again, in your dual plans, Medicare, Medicaid plans, Medicare prescription plans in those programs, and the food cards, the cards that you could use for utilities. That particular program, which is known to us as the VBID, Voluntary Benefit Incentive Plan, is no longer available. Now, I'm not telling you these things to frighten you. I'm telling you these things so that you can sit with an insurance professional who has already had to study, certify, pass examinations, and go through these various plans and learn what the differences are and how there may be other alternatives for you to still receive those benefits. Make it easy for yourself. Talk to an insurance professional, someone who can help you to actually look at those plans, look at particularly the plans for people who have Medicare and Medicaid, look at the level of Medicaid that you have, see what the changes for you will be in 2026, and make you aware of what is available for you. Another change in 2026 will be the increase in the Part B premium. The Part B premium, the standard premium, the floor level, at the floor, at ground level. The Part B premium for 2025 is $185. For 2026, that's $206.50. That's an increase. If you're new to Medicare and you will not have Medicare Part B until January of 2026 or beyond, you'll only see the $206.50. For those of you who are currently in Medicare, unless you have Medicare savings or some other program that's helping you to pay the Part B premium, your Part B premium will increase. Now, along with that, Social Security has said that they are expecting to also give you a 2.7% cost of living increase. That cost of living increase will absorb some of the increase for you, but it may not absorb all of the difference between the 185 and the 206.50. If you have a program now where that 206.50 is being reimbursed or paid through the state Medicare savings program, you just need to make sure that you are still eligible for your state's Medicare savings program. One of the options that you can choose for helping with this increase in Part B premium is looking for a plan that may offer you what's called Part B Give Back. Who is the person who can help you to find that plan if it's available in your area? The insurance professional. Formulary changes. This is another area where you may see changes. There will be tier changes, which means if a drug this year is a tier 1, next year it may be a tier 2. That may have little or no effect on what the cost to you will be. But if you have a tier 2 drug that's being changed to a tier 3, you could see a significant difference in what you're going to pay, because most of the plans have deductibles for tiers 3, 4, 5, and above. So that could be somewhere where you are affected, and that's why if you give the prescriptions to your insurance professional, they'll be able to use the tools that we have to put them in, and we can tell you exactly what your estimated cost would be for the drugs that you're taking. Also, if it's not a formulary change, there will be some drugs that have lower cost for 2026 because Medicare has already negotiated those pricing. They were negotiated this year, actually at the end of 2024 for 2026. So some of the tier 3 drugs that you have currently will have lower pricing. Also, there will be some drugs that will be removed from the formulary. They will not be covered at all. Formulary changes is something that you need to know about. Network changes. Yes, you love your doctor. Yes, your doctor is wonderful. Yes, you enjoy the staff. Yes, you know everybody in there and they know you. However, practices are still looking at how they can effectively do business. In other words, be medical providers, but still be profitable. So there are network changes. There are doctors who will not participate in certain plans. There are practices that will only take certain plans. There are practices that will only take certain types of plans. And in some rural areas, hospitals have decided because they can only do a certain number of people and take care of a certain number of people, that there will be plans that they will not accept. So network changes could affect you. In certain areas, there will be plans that you will get notice, if you haven't received it already, that that plan is not going to be available at all. So there are plan exits in certain areas of the country, some affected more than others, some where there are a greater number of people who are covered, and you don't want to be the last person to find out that your plan is not available. You do not want to be that person that goes to the pharmacy in January or call to order your prescription and find out that your plan doesn't exist, that the only thing you have is original Medicare. So plan exits you need to know about. Find out if your plan is going to be around. We talked about the benefit flex cards earlier. So now I've mentioned about 6 different things that could affect you. There may be other things that could affect you deeply, greatly, or with minimal effect. The thing is, are any of these things going to affect you? Are any of these changes going to really, really stand out for you? How will you know? So these are the 6 things that are most prevalent for changes for 2026. The annual maximum for covered prescription drugs going to $2,100. The Part B premium going to $206.50. Formulary changes that could change the cost of your drugs. Network changes that could change who's serving you and who's the best provider for services for you. Plan exits where the companies have decided they're not going to offer certain plans in certain areas. And then, of course, the biggest thing for most of you who may have Medicare and Medicaid would be the changes to the flex cards or the food cards or the utility cards, the one that you're getting. But let me make this clear. That change does not only affect people who had Medicare and Medicaid, but it will affect people who had the dual plans most heavily. You definitely need to make some kind of adjustment so that you can still receive some of the benefits that you were getting. I've kind of tried to highlight here the things that are you have control over. The annual maximum, neither you nor I have control over. The Part B increase in premium, neither you nor I have any control over. The plan exits, neither you nor I have any control over that. But what we can control is if there is a network change, we can decide, do we still want to use that provider or do we want to change our plan so that we can keep the provider that we have, or do we want to just change the doctor altogether? That's a decision you can make. Formulary changes: by giving your prescriptions to an insurance professional, by sending your information to me, by having that 15-minute call right after this, you have the opportunity to have me look at all of your prescriptions, where they'll be covered best, and you can decide if you're good where you are or if you need to change. And then, of course, the benefit changes to those cards, that VBID benefit. It's going to a different type of benefit, but there's still a way that you can get assistance. That's something you definitely need to look for in 2026. So you may have questions, but I have Medicare answers. I am forced, as every other insurance professional is, to actually look at what each plan changes are, what fits my customer best. That's what I do. I've been doing it long enough that I know how to do it and have the time and the patience to work with each of you who are interested in knowing more about what the changes are for 2026. So this is my number, 407-340-6282. Schedule a 15-minute interview. Most often it's maybe about 10 minutes, that first contact interview, and it's so that we can at least just get a starting point of where you are and where you need to be. 15-minute interview. So in order for me to give you answers to the questions that you have, I need your written permission. And that means that I need your scope of appointment. You're telling me, yes, I can talk to you about Medicare benefits and options. So in that 10 to 15-minute interview, I'm going to ask you for that permission, and I'm going to send you a link so that you can actually give me that written permission to talk to you about the benefits. It will all start with you. We're not bounty hunters. We're insurance professionals. So that means that I need to tell you what you might be looking for. You, as a prudent individual and adult, will know if any of these things hit home to you. So go ahead and set that appointment, or call me and we can set it. Your next steps would be for you to give me permission to contact you by either calling 407-340-6282 or by setting the appointment, 15-minute interview, at the link that's displayed on the screen. Set the date and time that's best for the call. If you want to just call me, put my number in your phone. It's Faye Horton, 407-340-6282, and we can set an appointment to talk for 10 or 15 minutes and at least get the ball rolling, so you're not wondering about it and you're not waiting until the last minute. You really want to have all this done by Thanksgiving so you can rest assured that next year you're going to be okay, have fun with your family. So you can meet me at the office, which is 199 Avenue B Northwest, Winter Haven. It's the Frontier Building, the old GTE building, and I'm in suite 240D. When you get off the elevator on the second floor, take a right, go down past Advent Bond Clinic, and come down the hall, and you'll find me there. Call me at 407-340-6282. Thank you again for watching this webinar, and thank you again for reaching out so that I can help you in the best way that I can.